Hi everyone, my name is Brett and welcome to the special walkthrough of NexaPoint Health where innovation meets patient care. For this video, I'll be showing you how NexaPoint Health helps medical professionals like you streamline every steps of patient's journey from intake to encounter to documentations, referrals, and even billing. If you're a provider or a medical assistant looking to save time, reduce clicks, boost efficiency, this is for you. Let's begin by logging in as a medical assistant. For this demonstration, we'll walk through the process of handling a visit for an established patient arriving at the clinic for an in-person appointment. From the dashboard, we click on Patients. Now, before we proceed in scheduling an appointment, we can also access patient chart by clicking the chart button. Once the chart is open, you will see the patient AI generated summary of all patient encounter, providing a quick access to essential information. The system make it really easy to spot anything unusual. It automatically highlights vital signs and biometrics in red or in yellow if they fall outside the normal range. For instances, it knows that the target blood pressure should be between 120 over 80 and 140 over 90 and healthy BMI falls between 18.5 and 24.9. You can also see here past patient encounters per categorized by date, reason, as well as duration. We can click on details to view progress note during that visit. You can also see here patient's past vital signs result. You can change into the graph view for different presentation. I want to highlight as well a key feature is Mia, our built-in AI assistant, which can answer questions directly to the patient chart. You can ask questions to Mia related to patient history. Mia then provide an answer to questions directly from the patient chart. We simply click on Ask Mia. A pop-up window will appear where you can type in your questions or use the microphone button to ask it verbally. For example, what and when is the latest total cholesterol results and what is the latest active medication intake? Then click Send. And then Mia will provide that information which she gathers from the patient's chart. Let's now go back to the patient section. Let's now click Book Appointment. Under Patient's Profile, you will ask to review patient's address information. You may click Next to proceed. Under Chief Complaint section, we are prompted to chat with Mia, our built-in AI assistant. This feature allows the patients to briefly describe the reason for a visit. For example, and then Mia will provide a personalized response based on that input, a unique features that supports autonomous appointment booking even without a staff involvement. This is especially valuable as well for clinics aiming to offer 24/7 access to patients' care. Once Mia gathered the necessary information, she'll guide the patient through selecting the suitable date and time for the visit. Let's enter the reason, chest pain, and select the available time. For payment information, let's say that this is an insurance payment and there will be a $20 copay. Then click Book Appointment. Once the appointment is successfully scheduled, we can view the details by clicking on the Details button. Once click, here you will find Patient Chief Complaint, which is powered by Mia, the AI. You can click on Patient Information to view patient details. And you can click on Patient History to update patient's history. And click on Vital Signs to view or add vital signs result. You can also add charges during the visit and you would have an option to cancel or reschedule the appointment. Let's now click on Patient Encounter tab. You will see a button to start dictation. Once click, the system begins recording the live conversation between the patient and the medical assistant. This voice capturing capability is another smart feature of NexaPoint Health designed to allow the staff and the providers to focus on care while allowing the system to handle the documentation in the background. Let's now click Start Dictation. While the session is recording, the medical assistant can continue updating patient's history and entering patient's vital signs. The medical assistant can search for template category based on the visit type. Let's search in the keyword chest pain, and then the system instantly provides a suggested clinical prompts. This is beneficial for medical assistants who may not have a clinical or medical background, as it would guide them through standardized prompts and ensures that all necessary and appropriate questions are addressed and documented during the encounter. Good morning. I'm Brett, your medical assistant for today. Can you confirm your full name and date of birth?
Sure, it's Maria Thompson, date of birth January 12, 1982.
Great, thank you. Let's start by reviewing your reason for today's visit. What brings you in?
I've been having chest pain mostly in the evenings, and it sometimes spread to my left arm.
Got it. When did the chest pain start and how would you describe it?
It started 4 days ago. It feels dull and pressure like, not sharp. It usually lasts about 15 to 20 minutes.
So, all done. I'll now transfer your encounter to the provider. Once the assessment is complete, we simply click on transfer, click yes. Now, the system automatically sends the encounter to the assigned providers, and the system will generate a summary of the visit, which is powered by an AI, and also provides a full transcription of the conversation for review and documentation purposes. Let's say that the medical assistant forgot to ask very important questions to the patient. The medical assistant may click on rejoin dictation, and the system will start recording again. And whatever information that the system captures during that dictation, it will gonna add up here in summary as well as in transcription. So let's now go ahead and change the rooming status to confirm, which means that the patient is now ready to be seen. Now let's log in as a provider. Upon logging in, I'm immediately presented with today's schedule. As you can see, a notification has appeared indicating that the medical assistant has completed their portion and the patient is now ready to be seen. When I click on this notification, I am taken directly to the in person encounter screen. Before starting the consultation, I can review the medical assistant AI generated summary along with a full transcription of the recorded conversation with the patient. This provides me with a clear, structured overview of patient's current complaint and history, all prepared before I join the meeting. Let's now go ahead and click on Patient Encounter and click on Join Dictation. Additionally, I can select a template category based on the visit type. Just search in the keyword, for example, chest pain, and the system instantly provides a suggested clinical prompts. This feature is incredibly helpful for providers, especially those managing a high patient volume, as it ensures that all relevant questions are addressed without having to rely solely on memory or manual intake. Good morning, Maria. I'm Dr. Brett. I've reviewed the summary from our medical assistant, and I see that you've having chest pain for the past 4 days that sometimes radiates to your left arm. Is that correct?
Yes, that's right.
Based on your symptoms, physical exams, and labs, my assessment is stable angina pectoris. Your elevated LDL and strong family history is increased your cardiovascular risk. So I recommend with further evaluation. So as of now, start taking with atorvastatin 20 milligram daily for your cholesterol. Continue your current antihypertensive medication. I would also like to refer to cardiology for stress testing and for further evaluation. And let's see you again in 2 weeks to review your progress. At this point, let's now go ahead and prescribe the medication to the patient. Let's click on e-prescribe and let's click create new RX and let's search the medication. Complete the fields including the dose, frequency, days of supplies and quantity, and any other clinical relevant instructions if applicable. Once done, click review and click save pending RX. Right now, let's go ahead and send that prescription to patient's preferred pharmacy and click pending RX. And let's enter the signature password, then click send. As we noticed earlier, that provider referred the patient to the cardiology. Let's click on referrals tab and select the physician and enter the reason for referral, for example, for chest testing. Once done, you can also add attachment to support the referral, or you can print the referral form. Let's now go ahead and send the referral via fax, then click send fax. The fax has been successfully submitted to the referred physician. Let's now go ahead and complete the appointment. Let's click on patient encounter and click on generate encounter summary and click yes. And then the system automatically generates a progress notes combining input from both medical assistant and the provider, which is powered by an AI. Now, the system done generating a progress notes, we can view the medical assistant summary as well as their transcription. And the system also provides a full transcription of the recorded conversation of the patient and the doctor. The system also captures patient's vital sign, chief complaint, history of present illness. Also, the system captures patient's laboratory result, physical exam and assessment that was conducted during the visit, as well as the plan of care, also the follow-up appointment. The system also provides a suggested ICD-10 diagnostic code based on the documented assessment. The provider may add another ICD-10 codes if necessary, just searching the keyword. For example, body mass index 24.0 to 24.9, and an option to select billing codes categorized by visit, duration, and complexity. After reviewing and confirming the progress notes, I can go ahead and complete the appointment and click yes. Once today's appointment is completed, the provider may proceed to the billing section to submit the claim. Let's click on your profile, then select billing, then click submit. Now, the claim will automatically transfer to the billing AA portal, which will handle the final submission to the clearinghouse. In the event of any denials, the billing AI will identify the issue and make the necessary corrections and resubmit the claim on your behalf. So this completes our provider's workflow. As you can see, NexaPoint Health is designed to streamline every steps of patient's journey, from intake to documentation to billing, while allowing the providers to stay focused on what really matters most, which is delivering an exceptional care. Thank you.